Good afternoon, everybody. This is Congressman Mike Levin. Thank you so much for joining us at our latest virtual town hall on COVID-19. I'm very grateful that you're here. Thanks to my entire team for helping to put this together, and thanks to our wonderful video conferencing crew as well. And as always, we are joined by our local expert, Dr. Richard Garfien, who is just doing a wonderful job throughout this pandemic. He is joining us virtually today. The Zoom background, I think, is Mount Shasta, if I got that right. And
that's correct.
Looks terrific. Dr. Garfien, as many of you who've been watching know, is a leading infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. He earned his PhD at Johns Hopkins University and his MPH at San Diego State University. He served as an Epidemic Intelligence Service Officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention in Atlanta, Georgia, before joining the UC San Diego faculty in 2005. Dr. Garfien's research focuses primarily on airborne and bloodborne infections, often associated with health disparities and substance use, including tuberculosis, HIV, and viral hepatitis in the United States and abroad. His research on digital adherence technology over the last decade informed CDC and World Health Organization guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. Of course, such technology has great relevance for COVID-19 today. Dr. Garfien, thank you so much, as always, for joining us.
It's a pleasure to be here, Mike. Thanks.
Over the next 90 minutes, as always, we're going to share the latest on COVID-19 from both a public health perspective and a policy perspective, and we're excited, as always, to answer your questions, many of which have been submitted online in advance. If you do have questions, please submit them via email at townhallquestions@mikelevin.org. Again, that's townhallquestions@mikelevin.org, and we'll do our best to answer them in the order received. And of course, we've got a bunch that were asked in advance of this town hall today. In addition to that, I want to encourage you to comment if you have questions or comments. We're tracking those as well for those of us watching on Facebook or on Twitter. As always, number one thing we need to do is stay healthy and stay safe and follow the guidelines of the Centers for Disease Control and Prevention, as well as the state of California, our counties in San Diego and Orange counties, and our cities. And it's so critically important that we do that because, as we have seen, the things that we've been doing, social distancing, staying at home, we now see positive signs that those things have been effective at helping to flatten the curve, and that is a very positive thing locally. Of course, as a country, this week very sadly marked the 50,000th death due to COVID-19. And for all those families who lost loved ones, our hearts and our thoughts and prayers are with each and every one of you as you've been dealing with this awful tragedy. In total, the United States, as you probably know, has by far the most confirmed coronavirus cases in the world, with a little over 907,000, now including 52,000 deaths. And California has 41,382 cases and 1,618 deaths. San Diego County has confirmed 2,826 cases. Orange County has confirmed 1,845 cases, 102 deaths so far in San Diego County, and 36 in Orange County. As we've discussed each week, the University of Washington Institute for Health Metrics and Evaluation, or IHME, they have a model that the federal government has used in the past and continues to use. It currently projects that 67,641 Americans will die of COVID-19 by August 4th, 2020, and that 1,719 of those deaths will occur in California, with peak hospital resource use actually having been on April 13th, so about 12 days ago. California Department of Public Health continues to say that in their estimation, peak hospital use will be sometime in mid-May. And so obviously there's some discrepancy there, but every day we see those numbers. They are heartbreaking, and we want to do everything we can to continue to flatten the curve. As I've said, every week I've tried to do a reset of where we are from a policy standpoint, and I'll do that again this afternoon. there are two simultaneous and interrelated crises in our nation. One is the public health crisis, and the other is the economic crisis. We cannot solve the economic crisis in the long run without dealing with the public health crisis. In other words, you cannot have a healthy economy unless you have healthy people. So that's what we've tried to do from the beginning of this. And in March, at the beginning of March, we passed our first bill, $8.3 billion for the development of a vaccine, as well as money to state and local health agencies. Then to mid-March, $200 billion, the Families First Act, trying to expand emergency sick leave, trying to help with additional nutrition assistance and more support for Medicaid. Then, as many of you know, at the end of March, we passed what's called the CARES Act. Now it's known as CARES 1 because we're already working on a CARES 2, the sequel to that. CARES 1 was a $2.2 trillion effort. From a public health perspective, $100 billion for hospitals and for frontline medical professionals, $16 billion for the National Strategic Stockpile for ventilators and respirators and PPE, about $20 billion for the VA to help, particularly with the VA health centers, $150 billion in new funding for state and local governments, of which about $15.3 billion came to the state of California, 559 plus million coming to San Diego County, 534.8 million coming to Orange County. When it came to the economic crisis for workers and their families, significant expansion of unemployment insurance, an extra $600 a week, taking the maximum unemployment insurance benefit in California from $1,800 a month to $4,200 a month, and also adding the expanded eligibility for gig economy workers, 1099 independent contractors. The good news is that those new policies, those new procedures are pretty much in place, and our understanding from the California Secretary of Labor is that the EDD will be ready to start dispersing those expanded unemployment insurance payments to Californians very soon if they're not already. CARES 1 also included direct cash payments of $1,200 and $500 per dependent for those making $75,000 a year or less. And as you probably know, $350 billion for what's known as the Paycheck Protection Program, a forgivable loan program for small businesses and for nonprofits of less than 500 people. And that program has not been without controversy because of some of the reports of where the money has gone. It was very important to us that as we consider extending that program, that we put guardrails on it, that we ensure specifically that community lenders, that smaller banks, that credit unions be able to have a dedicated part of those resources in order to basically to find the true mom and pop businesses that were left out. And I heard you from those mom and pop businesses that didn't get a dime in the first tranche of funds, and those nonprofit organizations that didn't get a dime. I heard you loud and clear. My great hope is that this second tranche, which is another $320 billion, that you will be able to get that Paycheck Protection Program loan, which is fully forgivable so long as it's used for payroll and for other overhead, rent, utilities, and within a prescribed time period. I am very proud of the fact that this past Wednesday, many of us flew from all over the country. We got to Washington, and this past Thursday morning, we passed the bill that not only expanded the Paycheck Protection Program, adding another $320 billion, but also we strongly advocated and got another $75 billion for our hospitals and our frontline medical professionals. I'm hoping that a lot more of those funds will come to the 49th District, and specifically that more money will go to places like community health centers that were really left out by and large in CARES 1. And importantly, we got $25 billion for testing. And specifically, the bill calls out the administration and says the administration must develop a national testing strategy for both the standard diagnostic test and the antibody test. Very, very critically important. And I am really encouraged by what we've seen on the local level as it pertains to testing. But at a national level, we know that we don't only need the money, but we also need that framework where the administration must now develop that national strategy, because that's the only way we're truly going to address long-term COVID-19 is to ensure that we've got testing, that we've got adequate contact tracing, that we've got treatments, and that we isolate folks and treat them, and then eventually that we have the vaccine. And that's what we need. We need more testing and fewer distractions, and that's what I hope this bill will do. We also, in this bill, or I should say in another bill that we voted on the same day, on Thursday, passed a new select committee, the creation of a new select committee to oversee where these funds are being spent. You probably know that the president decided to fire the inspector general who had been charged with overseeing the funds and appoint somebody that we believe may not be as objective. There is also a 5-member commission that the CARES 1 created to oversee those funds, but we decided to take it a step further and create a select committee dealing only with the oversight of those funds. And it's akin to the committee that Harry Truman chaired when he was a senator overseeing how money was spent during World War II. That committee during World War II that saved the United States $15 billion back then and only cost $1 million to administer. So what comes next? What comes next? I'd like to see a number of things. And it starts, I think, with CARES 2, with more funding for state and local governments. I've seen the requests. Governor Newsom requested $1 trillion for state and local government. You had other governors saying $500 billion. The bottom line is there's bipartisan, bicameral support for state and local government. You had Mitch McConnell this past week basically telling states to drop dead. I'm confident we're going to be able to overcome that, and we're going to get something done. And we have to get something done for also cities with fewer than 500,000 people. So I've advocated for specific language for cities like Carlsbad, like Oceanside, like Vista and Encinitas and San Clemente and all the rest, cities of less than 500,000 to get direct financial help. We need more funding for education. CARES 1 included $31 billion for education, and we know that higher ed in the 49th district did get some of that money. About $44 million went to UCSD and went to Miracosta, went to Saddleback College. We're going to need a lot more for K through 12 as well as higher ed, and I'm going to advocate for that. We need additional funding to secure our elections and protect the vote. I've supported national vote by mail before COVID-19. I think given what we saw in Wisconsin, where people were literally choosing between their health and their right to exercise their vote, now more than ever, we need national vote by mail. We also need to protect the United States Postal Service, which is going through tremendous financial hardship as a result of COVID-19, losing billions and billions of dollars of revenue. They were facing challenges even before COVID-19. Those challenges have only been exacerbated. And particularly of importance to me as I chair a subcommittee overseeing veterans' economic opportunity, there are over 100,000 veterans that are employed at the United States Postal Service. We have to keep them employed. I also believe as part of CARES 2, we're going to need hazard pay for our frontline workers and for those in harm's way. I'm going to strongly advocate for that. And we're going to need a big, bold jobs program to get millions of Americans back to work. As we've seen, 26 million Americans and counting have filed for unemployment insurance over the last 5 weeks. And I'd like to see investments in infrastructure, broadband access. We know that 21 million Americans lack access to broadband in our water systems, our electric grid. We need to do all these things anyway, irrespective. But COVID-19 and the fact that there are 26 million people who have recently filed for unemployment insurance should give us all the incentive that we need to move forward with a big, bold infrastructure program. Let's get America back to work. I'm going to be fighting specifically for the shovel-ready projects in the 49th district, already meeting with a lot of our cities and our city managers, our mayors, our local partners in transportation, trying to understand what projects are ready to go that we can advocate for, and that's what we're going to do. And I'm also working with my friend, Republican Rodney Davis of Illinois, to try to get the Prevent Family Fire Act as part of CARES 2. That would create a tax credit for safe storage devices for firearms. We know that firearm safe storage devices dramatically reduce accidents, particularly in the home, around 74% by the estimates that we've seen. and this would be a modest tax credit for those devices. And we certainly hope we can get it as part of the bill as children and their families are all at home. As we say all the time, but particularly now, please keep those firearms locked away to discourage any accidents from occurring. The other thing that we're seeing, and we're very saddened by this, is the stories of increased incidents of domestic violence. And of course, if anybody is of help or is of need and needs help, the National Domestic Violence Hotline can be called or texted at 1-800-799-SAFE. That number again, 1-800-799-SAFE. With that, I want to turn it over to Dr. Garfield for an opening statement, but I have to ask, maybe sarcastically, it's not good to ingest or inject Lysol or Clorox, correct, Doctor?
I would highly recommend that you do not inject any disinfectant whatsoever. It's dangerous and it's not helpful. The reason that disinfectants work is because they kill things. And that's fine if you're talking about a bacterium or a virus sitting on a countertop or on your hands. But when you put those things inside of your body, they not only kill the virus and the bacteria, they kill all the cells that keep us alive. So don't do it. And the same goes for ultraviolet light.
Thank you for your clarification. But
Did I really?
In all seriousness, the president's words do matter, and we know people are paying attention. So I appreciate your providing that context.
Absolutely. So I'm gonna pass on the opening statement today, and I'm just gonna let you jump into the questions. And I've got a few thoughts that I'll wrap up with at the end.
Terrific. All right, that sounds good. We got a ton of questions this week, and many of them are about the Small Business Administration, the Paycheck Protection Program. And we heard from Jennifer and Jeff in Encinitas, who own a small design business, Alexa in Oceanside, who owns a vending business, Brenda, who has a woman-owned manufacturing business in Vista, and Amanda, who owns a preschool in Encinitas, and finally, Marie in Encinitas. And I have to tell you, Jennifer and Jeff and Alexa and Brenda and Amanda and Marie, I've read each of your stories. Your emails are heartbreaking, and I'm hoping that this latest round of funding will help. And I'd like to first and foremost offer my office as a resource to you as you walk through the program with your lender. Perhaps you need a new lender. We can help with that, at least point you in the direction with the help of also the local SBDC, Small Business Development Center. But some of the questions, I would like to understand how the PPP has been so mismanaged. How is it fair that small businesses like mine were forced to compete for loans against firms with dedicated staffs of financial advisors? What exactly are you prepared to do to help small businesses endure this crisis? In the next round of PPP loans, what guidelines are being given to the banks to help distribute funds to small businesses that were not able to be in front of the line? Is there any language in the next version of the PPP that would help direct funds to the truly small businesses? So, yes, first and foremost, there are changes, significant changes to the second tranche of funds. Specifically, we've set aside $60 billion for the smaller lenders. And to take a step back, the PPP is administered by the roughly 3,500 lenders that do business with the Small Business Administration. And the challenge was that a lot of the larger banks were working with their customers, and were doing it in some cases with, they were working with companies that were public companies or more established companies. We saw the stories about Ruth's Chris and Potbelly and Shake Shack and all the rest. And I'm not picking on them because I know that all sorts of businesses are hurting right now. However, the intent, and I can tell you from the discussions that we had as members of Congress, was to help the truly mom and pop small business. So my great hope is that the $60 billion that is dedicated, that must be lent by the small and medium-sized community lenders, will go to those mom and pop small businesses. What I've also heard is that a number of those applicants that have been frustrated with their existing lender, they're now going to have more flexibility to be able to go to those small and mid-sized lenders. There's also a lot of money in this bill for what's called EIDL, the Economic Injury Disaster Loan Program. And hopefully those funds will go to those mom and pop small businesses that truly need it. Again, this PPP, far from perfect, but very important that we get that money out to the small business community. The fact that the existing queue of those borrowers interested in additional funds probably will be hundreds of billions of dollars, and that this new tranche of 320, I think it's going to go very quickly. There's already been discussion in the House about needing a third tranche of funds. I'm okay to do that if there are guardrails in place. I also think that many of those companies that are on the fence, those bigger companies on the fence about returning those funds, they need to return those funds because it's intended for those small mom and pop businesses that really need the help the most. Debbie asks, I am very disturbed by the requirements to receive small business loans for COVID-19. My employer recently received more than $700,000 as a small business loan. The company has not had to lay off a single person as a result of the pandemic. This money could have been used by several other small businesses who had genuine damage from the pandemic. In the most recent bill, is there some requirement for recipients to demonstrate negative impacts of COVID? And I would like to appeal to a good many more politicians making decisions about releasing this money. If there is a good avenue to do so, please tell me. Well, Debbie, by writing me, you certainly, that is a good avenue to reach me. And I think it's really true that we've seen a number of companies who are really not that much in need compared to, again, some of those small mom and pop small businesses. And I was very pleased that there's that specific pot of money strictly for those smaller businesses that use those small community banks. Because at the end of the day, it shouldn't just be the well-connected that get these loans. So thank you for that. And obviously, if you're interested in appealing to any other elected officials, I would contact my official office. You can contact your senators as well. Here's a question for you, Dr. Garfien, from George on Facebook. And there's another similar question from Lori in San Clemente. So combining the two. Have we researched interferon alpha 2b? It's worked on similar viruses like dengue fever, AIDS, and SARS. How about other HIV antiviral drugs? Okay, well, there's two parts of that question. So let me start with the interferon part. Interferons are small molecules produced by human cells to signal the immune system to respond to things like viruses, cancer cells, bacteria, and other foreign substances that invade the body. So they're kind of like the first line of defense to ramp up the immune system. Interferons don't kill the virus directly. Instead, they boost the immune response to fight the invasion. And so for this reason, interferon therapy, and there's several different kinds. There's alpha interferons and gamma interferons, and there's different type varieties as well. So, and different ones are used for different reasons. But interferon therapy has been used to treat autoimmune diseases like multiple sclerosis. And when hepatitis C virus was first discovered, interferon was pretty much the only type of treatment that was available to treat hepatitis C. And it wasn't a very effective treatment, but it was all we had until more recently we've developed some much better drugs. The problem with the interferons is that interferons are responsible for the flu-like symptoms that we feel when we get infected with pretty much any virus. It's our body's first line of defense. When there's a foreign invader, they ramp up the immune system, and they cause all of those terrible symptoms that we all get when we are exposed to a virus, like the flu, which is, potentially fever, muscle aches, body aches, headaches, upset stomachs. And so the treatment itself is not necessarily a pleasant treatment, and it can actually exacerbate the symptoms of COVID. So there are some trials that are currently underway for using interferons because right now doctors are trying everything. They have to be done in a deliberate way so that we know if they're working and if they're harmful.
there are some trials going on with that. I haven't heard of any that have been found to be effective yet, but those trials are being done. The other part of that question is about antiviral drugs, or HIV, and other viral infections. And there are several clinical trials underway right now around the world. Some that have already been done in China, some that are currently underway in the U.S. And UC San Diego is doing some of these trials as well, or involved in them. Two of these drugs, which many people have heard of, are remdesivir and tocilizumab. These are both drugs that have been used for other viral infections and have been found to be safe, when used as developed. But we don't know yet whether or not they're more effective than just the standard of care, which is basically supporting the patients until they recover on their own. So these drugs need to be evaluated carefully. We're hoping that they'll work, but it's unclear yet whether or not they're the solution. And then finally, I'll just mention hydrochloroquine and chloroquine, which also people have been hearing a lot about, and the president had touted those very early as being effective. These are medications that were originally developed to treat malaria or to prevent malaria, and they've also been found to be effective in treating some other diseases like lupus. The problem is that they have been found to have some dangerous side effects. So if they're not used correctly, they can damage the liver. They can cause problems with the heart, and they can be very dangerous. And these drugs are also in clinical trials right now. The preliminary results are not especially promising, but those trials haven't finished yet, so we don't know the definitive answer. But if anybody's thinking about taking these medications on their own, maybe you're finding them on the internet, I highly discourage you from doing so, because they have been found to be dangerous if they're not taken correctly.
Thank you for all of that, Dr. Garfien. Appreciate it very much. Ira in Del Mar asks, or says, thus far, President Trump has successfully sidestepped every attempt to rein in abuse of the system. He fired the career IGs and replaced them with people loyal only to him. And the oversight panel can only function if the Republicans appoint their members, and McConnell agrees with Pelosi on a fifth member. What provisions can the House put into any new legislation which will provide real-time auditing? Why don't Pelosi and the Democratic majority simply say no if these controls are not included in the legislation? Ira, that's an excellent question. As I mentioned, this past Thursday, a couple days ago, we flew to Washington and we passed not only the interim bill, which you could call Bill 3.5, so the $484 billion for the SBA and the testing and the hospitals. We also importantly passed another measure to create the select committee to oversee the funds. That's chaired by my colleague Jim Clyburn of South Carolina, a very senior member who also serves as the House Majority Whip. That committee, I think, will play a vital role because it will also, I would imagine, it will hold hearings. It has full subpoena power. It will do everything possible to try to get waste, fraud, and abuse out of the system. The other thing is that the Government Accountability Office, which is Congress's watchdog that is intended to operate independent of the executive branch, I think will play an important role in determining how whether these funds have been appropriately spent or not. But I feel very strongly, and I agree with you, Ira, that the original CARES Act and all the bills that we passed, the CARES 2, need to go further still. And what we did do in CARES 1, we ensured that the president and his family couldn't directly benefit. There's specific language in there, couldn't directly financially benefit. There's also language in there about the companies themselves receiving the money, not being able to do stock buybacks and dividends or have executive compensation that is excessive. But we need to go further. And I'm going to do everything I can as a member of Congress to hold this administration accountable for how relief funds are distributed, for how supplies are distributed. That's why we wrote that letter to FEMA demanding more information, where 56 of our colleagues joined us regarding Operation Airbridge, And if you didn't see the article in the Los Angeles Times last week, you can go to our website and check that out as well. Here's a question for Dr. Garfien from Joan in Oceanside. Some of us were extremely ill in December and January. Pneumonia, high fever, nearly drowning from mucus in the lungs. But we stayed home, away from everyone, everywhere. Will anyone ever test us when the antibody test is perfected to see if we already have immunity? And I'm going to even add another wrinkle to this question, which is we've seen a number of stories now that you can get COVID multiple times. So if you could comment on antibody testing and also on immunity and what that looks like, that would be fantastic.
Sure. So that's a great question, Joan, and I'm hearing more and more of that from people who are now saying, thinking back to the early part of the year, I was pretty sick. I wonder if I had coronavirus, and maybe if I got tested, I could find out if I'm safe to go back to work or go back out in public because I don't have to worry about being infected. So I think that your question is an excellent one, and a lot of people are asking it. So thank you for asking that question. So currently, the CDC is not considering people without symptoms to be a priority for testing. There's not enough testing. It's got to be used for other reasons. But now we need to keep in mind that there's two kinds of tests. There's the viral test, or PCR, or RNA test that people have been using since the beginning of the epidemic, which is used to see if there's actually virus in the person who is sick with symptoms at the time. That's where they take the swab of the throat or the nose, and they actually look for the genetic material in the virus to indicate that that person is actively infected. The second test that people have been talking about is the antibody test. And this is a test that looks for proteins that are produced by the immune system in response to being infected with the virus. And that test will actually show two different kinds of antibodies, one that shows up very early after infection, usually within a few days, but maybe after the virus is already detected. So you can detect virus before you can detect these antibodies. And then there's another class of antibodies, the IgG antibody, that shows up maybe another week after infection and will stay around longer. And so if somebody's been infected and recovered, we could do an antibody test to see if they have those IgG antibodies to indicate that they had been infected in the past. Now, the question is, do those antibodies actually protect you from being reinfected? And the hope is that they do. And we say that because pretty much all other viral infections do create some immunity after a person recovers from the infection. So we don't expect that the coronavirus is that different, but we do need to do more research to make sure that that's actually true in this case. And if that's true, then we can start to say, well, these people are immune and could, go back into society more safely. However, the problem there is that the tests are not perfect. And so just because you test positive for antibodies, it might be a false positive. And if you're told that you can go back and be exposed, and you might end up actually getting infected, and the outcome could be bad. So why would we do these tests for people that have already been had an illness and resolved? Well, one reason might be is because there is something called plasma therapy, where people who have been infected and have recovered have antibodies in their blood that could actually be protective of somebody who, if they're injected into somebody who is currently sick or maybe just been exposed. This is a therapy that's been used before for other diseases, other types of viral infections, and it works quite well. And so there's studies taking place right now, including at UCSD, that are evaluating the effectiveness of this therapy in humans for coronavirus 19. But we have to be careful because we don't want, if there could be a risk to doing it, and so doctors are making sure that they're evaluating it carefully to make sure that it isn't going to increase a person's risk as well as having some benefit to it. So some people may be getting tested now to see if they have antibodies because they could be very important and very, very beneficial donors of plasma to help people that that might be sick right now. So that was a long answer, but to get to the point of your question is, will there be a time when people can be tested just to find out if they really did already have the coronavirus? That may be coming in the future. I wouldn't anticipate it right away. More likely there might be some testing that's offered for people that are known to have had coronavirus disease so that they can be potential donors. And then finally, to the Congressman's point about reinfection, as I said, for everything we know, we think that coronavirus disease and recovery will confer some level of immunity, at least in the short term. We don't know how long that'll last yet because it's a brand new infection, so we don't know how long the protection will last. But there have been a couple of incidents reported from China and also, I believe, in New York, where it looks like somebody had recovered, and then when they were tested to see if they had virus in their nasal pharynx, it was negative, and then a few weeks later they became a positive on the viral test again, and that would suggest reinfection. However, we don't know for sure if they were reinfected or there was a false negative on the test, or potentially they were starting to get better, but they didn't quite fully recover and they had a reoccurrence of the same disease. So we don't know the conclusive answer yet. It doesn't seem like it's very common that reinfection is occurring, but we need to do more research to make sure that we know the right answer for that.
Got it. Excellent. Next question from two different people. Marilyn, who is a veteran in Oceanside, and Vladimiro, also from Oceanside. They both asked some variety of the following. I've heard there are a lot of virus cases on Camp Pendleton. What do you know about this? Marilyn and Vladimiro, I can tell you that the DOD has cited some operation security and readiness concerns about saying exactly how many people on different installations are COVID positive or how many cases they've had. But we do know roughly 1,500 overall active duty service members have tested positive for COVID-19. What I would also say is I'm in touch frequently with our base leadership, and I think they're doing an outstanding job. And I have every confidence in our local leaders at Camp Pendleton and our men and women serving there that Camp Pendleton itself is under great leadership. And until I hear anything to the contrary, that's how I'll feel. Great respect for all of them leading the way at Camp Pendleton. Question for both of us from Jeffrey in Encinitas. Jeffrey writes, I'm the medical director of an I group. We have 55 employees, including 9 doctors. We're open only for urgent and emergency care, but most of our patients require routine visits. When do you think the governor will give a green light for us opening as an essential service? You want to take that one first, doctor?
I'll give it a shot. I think it's an excellent question. I think that, like any other business, as we start to go back, whether it's schools, whether it's stores, whether it's dentist offices, optometrists, I think it really comes down to how efficient and effective can we be in minimizing the chances that somebody, either the healthcare provider or the eye doctor or the patient, is infected, and what's the probability that they're going to infect the person that they're next to. And so I think what we have to really be thinking about is, what can we do in these situations to minimize that risk? And so I know eye doctors are not accustomed to wearing masks when they're seeing patients, the way dentists are and most healthcare providers are, but maybe that will become standard practice for a while. In addition, perhaps the patient would need to wear a mask when they're being seen at the eye doctor to help to protect the staff and the providers at the eye doctor's office. What I would recommend is that everybody in all these industries start to work together to develop protocols of best practice operating procedures to show that you really thought about this and you come up with strategies for how to engage with the public in a safe way. You want to protect yourself and your staff. You also want to protect the patients that are coming into your clinic. I think the sooner we sort of learn how to do things in a safe manner until the coronavirus goes away, this is how we need to operate. So I don't have a deadline for you, but this is, I think, what we need to think about in terms of how we're going to get to that point.
Well, and I also think that the governor is going to look at this through the lens of the 6 factors, right, that he talked about last week. So obviously, the ability to monitor through testing, contact tracing, isolating, and supporting those who are positive or exposed, the ability to prevent infection in people who are at risk, the ability of the hospital and health systems to handle surges, the ability to develop therapeutics, the ability for businesses, schools, and childcare facilities to support physical distancing, and the ability to determine when to reinstitute certain measures, such as the stay-at-home orders, if necessary. So, the governor laid these out recently. Hopefully, we'll get updates very soon as to a progress report. But I think as we go further along and as we meet these 6 criteria, and certainly indications are that we're doing pretty well in California and that a lot of the policies are working, that we'll be able to get back to business as usual a lot quicker, and that would include your business, Jeffrey. Here's a question for you, Dr. Garfien, from Dennis in Dana Point. He's obviously watched before because he starts by saying last week, so he saw you last week.
Welcome back.
So you have to be careful what you say and make sure you're consistent. Last week you said that surgical masks should be one and done. I have 4 and rarely use them more than once every 2 to 3 days. If I rotate them, that would mean I wouldn't need to reuse one for 8 to 12 days. Is this a safe practice? Great question.
That is a really great question. So, Dennis, I think what we have to consider is, what are we using the mask for? For most of us, we're wearing them when we go out in public on an off chance that we might be infected and not know it, and we want to prevent spreading the virus to other people inadvertently through coughing, sneezing, and even talking and breathing could potentially spread some virus out into the air for somebody else to inhale. So if you're using it for that purpose, really what the mask is contaminated with is yourself, and you want to think about it, how is the best way to manage that. The CDC has one recommendation. They don't recommend it strongly, but in the most serious situation where there just are not enough masks and there's no way to decontaminate, they have come up with a protocol of giving a healthcare worker a number of masks, say 5, and then 5 paper bags that each bag is labeled with a date and that person's name on it. And they'll use a mask for a day, put the mask in the paper bag and set it aside, and then do the same thing for 5 days in a row. And on the 6th day, they go back and use the first mask again. Again, this is for that person only. Doesn't mean that it's safe for anybody else to use, but but within 5 days, any coronavirus that's on there should have died. And so that's sort of worst case scenario. I'm not recommending it, but it sounds like you've already thought about that. And so your thinking is not totally out there. In terms of masks that we're using at home and in the community, people have asked about decontamination, and there have been a number of studies done by the NIH and the Department of Defense and universities to look at what's safe and effective. And there's only been a few that have actually been found to be effective, which is like ethylene oxide gas, vaporous hydrogen peroxide decontamination, and ultraviolet germicidal radiation. Now, these all sound really complicated, and they are. So these aren't the kinds of things you would do at home. These are things that you'd have to have a facility to do them in, to do them correctly. And they also break down the mask itself. So even with these, you can only use the mask 2 to 3 times. So there really isn't anything that you can do at home safely. You can't spray a mask with alcohol or disinfectant because 1, it'll break down the mask, and 2, you may end up breathing in toxic chemicals and hurt yourself. So what I would actually suggest is if you use a cloth face mask, the kind that you can make out of a dish towel or an old T-shirt or a bandana, You could use that, and every day you just throw it right in the wash with all the rest of your wash, and it'll come out clean. It'll be perfectly fine to put back on. So if you've got some of those face masks, or if you have a supply of them, donate them to a clinic. But if you've got your own and you're using them and you run out, then, use a cloth face mask. It'll serve the purpose of protecting the community. They're not recommended to necessarily protect you if you know you're in contact with somebody who's infected, but they're perfectly acceptable for protecting the community.
Excellent. All right, I wasn't going to do this, but you brought up radiation, so I have to ask about heat and light and your comments on all of that. We talked about not ingesting Lysol, but I want to hear your thoughts on heat and light.
If you had the ability to irradiate yourself with the right ultraviolet light and somehow get it into your body, it would do the same thing that disinfectants do. It kills cells, not just viruses and bacteria, but it'll hurt your cells. So
all
don't
cells.
recommend it. Yes, all cells.
That sounds like a bad strategy.
Yes. The other thing is, and you'll notice this if you ever had a tooth filled at the dentist and they use the ultraviolet light to cure the dental filling. They're very, very careful to all be wearing eye shields and shield your mouth so that they don't burn you with the ultraviolet. It's not a good thing. And then heat, same thing. The heat will inactivate the virus, same as ultraviolet light, but these aren't things you would necessarily do to your body. But if you, in the environment, heat and sunlight are very good at killing viruses and bacteria. So if you want to visit with people, you're safer being outside on a sunny day talking than sitting in a closed room where the bacteria or the viruses could build up and you can breathe them in.
So being in the house chamber is probably not the greatest idea. We had all kinds of social distancing this week, Doctor. You'd have been very proud of us. They had a system where you went in one door, you vote, and then you basically went straight out to a different door. And it was so different from what is normal, because usually the House of Representatives is just, a bunch of people talking to one another on the floor, in the cloakroom, in the hallway, etc. And it was really a single file kind of thing. So a very different voting experience, to say the least. Bev in Oceanside asks, all elements of the food chain need to be protected. Is Congress addressing that specifically? And a similar question from David. Mike, what can you do to increase assistance from the USDA so that farmers would be able to more effectively move undistributed and harvested crops to food banks? Excellent questions. What I can tell you is that very regularly we, as a caucus, we talk to the chairs of our committees. Colin Peterson is the chair of the Agriculture Committee, and what he's told us time and time again is that we don't have at least as of last week, a large problem with food production. Now we're seeing problems with meat. We're reading about that, beef and pork, etc. The problem is with food distribution rather than food production. That may change as this evolves. But I suppose what Congress could do is it could allocate more funding to USDA to help move the undistributed food to food banks. I think it's a very interesting idea, and I'm going to take it back and talk to my staff about it. But what I can tell you, I have been in touch with a variety of local food banks in general to see how they're doing, to see what their needs are. I'll touch base with them as well to see if that is an ongoing concern. But your point is very well taken. Here's a question for Dr. Garfien. This is from James in Encinitas. James asks, although our curve is lower than expected, it isn't subsiding enough to say the peak is near. Am I right?
You're absolutely right. We're not there yet, and I think we're going to be a long way off. Cases continue to occur, and although the number of new cases is not as increasing as fast as it was before, we still are having a large number of cases every day of new cases of coronavirus. And the way maybe to think about this, I'm going to try out this analogy and see how it flows. It's sort of like you're driving in your car, and all of a sudden you run into an ice storm. And at first, everything's going crazy. You can't control it. your car's spinning out of control. And what you first need to do is you need to slow the car down. And so, you put on the brakes, you try to slow down, you kind of get the car under control so it's still running, but you're still in that snowstorm, and everything can happen really quickly if things get out of control. And so we're kind of there. And the point of this is that the cases were increasing very rapidly, and coincident with that, the number of deaths that were occurring rapidly, and we had to get things under control, because if they kept on rising, they were going to get to the point where the healthcare system was going to be overwhelmed, and then the number of deaths would go up even faster, because there wouldn't be enough capacity in the healthcare system to take care of the people that are really sick and really need it. So what we're doing with social distancing and stay-at-home orders is really trying to slow down that increase, and then sort of get it to a point where we're tapering off and hopefully dropping down, but always staying below that line of capacity of the healthcare system. We know those are going to be cases. We know people are going to get sick. We know, unfortunately, people will die, but we want to be able to do the best job that we can as a community to keep the number of infections low enough that our healthcare system doesn't get overwhelmed. But by doing so, that also means that we're stretching out the curve. It means that we're going to be dealing with this for a much longer period of time, because by slowing things down, fewer people have already been infected. And as long as we have a lot of people who are susceptible, they will still be at risk of becoming infected, and there will be more cases going on. And so a few studies have been done now in different cities. There's Santa Clara, California, there's New York City, Washington, all looking at the prevalence of infection by taking samples of the community to see how much infection there was. And the infection rate appears to be sort of in the 2 to 10% range, a little bit higher in New York City. So whatever it is, it's still very low, meaning that we still have the majority of the population that are at risk. And so if we open up the valve and we let people go back to work or step on the gas trying to get through the snowstorm faster, we're going to have a lot more cases, and we're going to run back into that problem of having another peak that could exceed the capacity of our healthcare system, and that's what we're trying to avoid. So, we seem to be getting close to the point where things are starting to not increase as fast as they were before, and that's a really good sign. It shows that what we're doing is working, but it doesn't mean that we're going to get to a point where we can just stop and go back to normal all of a sudden.
Thank you. Incredibly important explanation, and I know you've given a similar explanation a few times, and I think it's important to continue to hear the sound science behind why these measures have been taken. That no question have had devastating impact on our economy, but at the end of the day, as we've said, can't have a healthy economy unless you've got healthy people in the long run. Eric in San Juan Capistrano asks, what is being done in Congress to ensure our most vulnerable populations get their economic impact payments, as many do not have bank accounts and haven't filed tax returns? Eric, that's an excellent question. And the economic impact payments are those direct cash payments of up to $1,200 that we mentioned before. What I would say first is, if you don't have a bank account and you haven't set up direct deposit with the IRS and you're still eligible, you will receive a paper check. That paper check will be mailed to you in the order of your adjusted gross income, with the lowest income individuals being mailed their checks first. 5 million checks a week. I wish it were faster than that, frankly, but that's what we've been told the capacity is for the printing of those checks. Now, if you believe that you're entitled to a check and you have any questions about this, feel free to contact our office. Our official staff would be ready to assist you, to point you in the right direction. In the event also that you do have a bank account, but that you have not set up direct deposit with the IRS, there's a portal where you can very quickly and very easily set up the direct deposit information so you can receive a direct deposit. The last thing I'll say is that there are some scams out there. There are people saying, get your $1,200, pay us 10%, and we'll help. Those are scams. No one's intended to profit from this. So don't believe anybody telling you that they will take payment in order to help you receive your direct cash payment, because that's not how it was intended to work, and that's just flat out a scam. So let's see. David in Dana Point asks, thank you for passing the CARES Act. Nevertheless, many hardworking immigrants are excluded. Can undocumented immigrants who file taxes using a TIN apply for a stimulus check, unemployment, or other benefits? If not, how can the federal government help them? Well, the short answer is no. Unfortunately, that is not the case. However, Governor Newsom has set up a fund and developed a resource guide for the immigrant community. And there's also an organization called Grant Makers Concerned with Immigrants and Resources, or Immigrants and Refugees, or GCIR. And you can learn more about their work at immigrantfundca.org. So between the state of California and the GCIR, there's about $175 million specifically allocated for the immigrant community. That was unfortunately one of those things in the CARES Act and the other legislation. Getting bipartisan support for that was impossible. And we had to move forward, and we had to do all that we could to get much needed funds to all that we could. And again, it's something that I'm very mindful of because you're right. I do believe that we should have done more to try to fight for immigrants during this time. Here's a question for Dr. Garfien from Cliff in Cardiff. And this is a good one. It's a simple one, but it's an important question. Hey, doctor, when will you be surfing again?
Not soon enough. I plan to go out on Monday morning, but it will have to be on a county beach since the city beaches are still closed for the time being. My plan is that I'm going to go straight to the beach and come straight home. I won't hang out on the beach or on the streets socializing with my buddies. Also, when I'm in the water, I'll plan on staying 6 feet or more away from people, which is pretty normal for surfing. We tend to not want to bunch up, and if we do, it's usually not intentional. But it's something that has been a big issue. I think that there's been a lot of people that have been pushing back on that rule of closing the beaches and keeping people out of the water. There's paddle boarders, there's kayakers, there's a lot of people that use the water here in San Diego that really understand that there's probably a very, very low risk of transmission when you're out doing these activities. But we also understand that it's very hard to make exceptions for one group and not for others. And so as soon as you start sort of going down that slippery slope of making exceptions for surfers, then, who's going to be next that's going to want an exception for their activities. So I think we've all done a really good job here in San Diego and Orange County of saying, we're all in this together. Not everybody's going to be able to do their sport for a little while. We can make some exceptions for walking and getting out to get some exercise, but we really have to be in this together, and we're all going to sacrifice. So I feel like it's something that was worth not pushing. I'm really excited to be going back in the water, though. Now, one caveat is that there was a researcher from the Scripps Institute of Oceanography who suggested a few weeks ago in an editorial article that through her research and some really, really fine research at Scripps has shown that it's possible for pathogens to actually be aerosolized through the motion of wave action. And then those particles can be carried in the air and potentially inhaled by people walking on the beach or, maybe a little further away. And so surfers could potentially be exposed in the same way, as well as surfers may be exposed to bacteria and viruses in the water. And we're all aware of that. So we make it a habit of not surfing, for 72 hours after a big rain. And just to sort of wrap that up, the coronavirus has been found in stool, and so it makes sense that it might be getting in the sewage system and then eventually getting out into the ocean. But until I actually see some data that suggests that the virus remains viable after it goes through the sewage system, through the sewage treatment plant, out the effluent pipe, into the water, and then gets back out to the surf line, I think that would take a pretty hardy virus and I'm hoping that coronavirus isn't one of those. But I give I have to respect the research done by the Scripps Institute, and that research is going on, and I think we'll have to see what comes out of that.
Well, I look forward to hearing how your surfing while social distancing goes Monday. But stay.
I might not be. I might have to miss this one next week. Might depends on what the surf conditions are.
Stay safe. If anybody's going to do it responsibly, you're the guy. So that is good.
Thanks.
Here's a question from David in Del Mar. David says, thanks for holding this virtual event. We hope all is well with you, your family, and staff. All is well. As far as my family goes, they're downstairs right now, and the homeschooling has been pretty interesting. We have a 7 and a 6-year-old at home, so I've never had so much respect for people who homeschool their kids, I'll tell you, but we're doing just fine. David says, it is important for the country to minimize the financial impact of COVID-19 in the short term. This will have long-term implications. What will be done about the huge increases in the federal deficit in the aftermath? New taxes, reinstatement of PAYGO, cuts in federal programs. David, I absolutely agree with you. This is a huge, huge problem. It was a huge problem before COVID-19. It will be an even bigger problem after COVID-19. By the estimates that I've seen, our deficit to GDP ratio this year will be on the order of 13% or higher. That will be the highest it's been since World War II. The percentage of our budget that we spend on servicing the debt will be incredibly high. It already is incredibly high, will be even higher. And we're looking long term at 28, 29, $30 trillion in debt. And in the near term, this is how I felt before COVID, and I think even more now, we have to look at our revenue and our spending, and we've got to make some tough decisions about our priorities. And I continue to believe that it's best to grow the economy from the middle out, not from the top down. And that means that some of the tax policies that were put in place in 2017 need to be thoroughly evaluated. I have called for the repeal of the state and local tax deduction, which I think was deeply punitive to the state of California and other higher tax states. I think as we have this whole discussion around providing additional resources to state and local governments, we also have to be mindful of the fact that we repealed the state and local tax deduction, and that was very hard on a number of the residents and many of the residents in the 49th district. Just the same, I think long term, we have to be thinking about those things when we do spend money that are stimulative, that will produce real return, like infrastructure. We know, and all the empirical data over many decades suggests that infrastructure projects provide significant long-term benefit. And by the way, we'll put millions and millions of people back to work. And that's what we need to do. We've got 26 million that have filed for unemployment in the last 5 weeks. We've got to put people back to work. So if we're going to spend money on a big, bold infrastructure package, count me in. And that's what I would much rather do than provide massive tax breaks to those at the very top. And it's interesting that Mitch McConnell, who was completely okay with racking up trillions in debt for those types of tax policies, now says let's take a pause when we want to do things like help state and local government, when we want to protect our frontline medical workers and other heroes, and when we want to do things like infrastructure. So I think it's a matter of priorities, and I look forward to working with my colleagues to hopefully get this right for future generations. But I think about it all the time. Here's a question for you, Dr. Garfien, from Paul in Del Mar. We hear testing must be doubled to verify low spread rates are achieved before opening our country. To date, 20% of tests are reported positive. That appears to be low, given only sick or those known to be exposed were tested. What rates for the general population must be achieved to start the opening process? So as Paul correctly points out, the prevalence of positive results is dependent on who's tested. So I think that was astute in noting that, even in the highest risk people, the prevalence seems to be
20% or so, which is still means that there's a lot of people out there that are susceptible. That's an important point when we talk about herd immunity, which is where you have enough people in the population that are immune, whether by vaccination or by natural infection. You need about 70% of the population to be infected in order to stop the virus from transmitting from person to person and continuing to spread. Herd immunity is when you surround somebody who's infected with a bunch of people who are not susceptible, and so that person can't infect anybody, and the disease dies out with that person. But we have to get to a much higher prevalence before we're going to be there. When we talk about, at what rates does the epidemic have to be before we can start going back to life as we know it? What we've been waiting for is the number of new cases to stop increasing daily for at least 14 days. That's the incubation period for the study. And that would be sort of a marker of the curve flattening. And then we can say, okay, we've sort of got this under control. It's still happening. We'd like it to go down to 0, but, in the meantime, we know that we stopped it from increasing. So I think we're getting close to that point here. There's different mathematical models that have been produced. Some have said, mid-April, some have said mid-May. And they change also because the epidemic is changing. It has depended on how effective the control measures are that were put in place. And so these control measures are starting to work, and I think that the curve is flattening. And so that's why we're starting to think about opening things up right now. But rather than thinking about, what rate are we looking for things to start opening up, I think what we really need to be thinking of is sort of the long term here, which is the implementation of practices that will allow us to continue social distancing as we go back to shopping and attending events and the like, so that we have a combination of being able to continue practicing social distancing while we're in public, increasing the amount of testing that we're doing so that we can determine who's infected and who's immune, and to implement contact tracing, which hasn't been done enough yet, which is a process of identifying people who have the disease and then finding out who they've been in contact with, and then notifying those people that they were in contact with, and asking them to, or compelling them to stay quarantined for the 14-day incubation period, so that they don't infect anybody before they realize that they actually are sick and would transmit the infection. So we're trying to get all these pieces into place so that we can start to go back safely. And then I think that we have to be prepared that if the rates start to climb back up, we're going to have to dial things back a little bit and get things back under control, and then do a better job of learning what it's going to take to prevent the infection from spreading.
Thank you. Really outstanding answer. Here's a question from a physician at the VA. And he writes, we're constantly dealing with shortages of N95 masks, face shields, and other needed equipment. On the testing end, we're scrambling to find suitable swabs and transport material. We should be testing everyone who's being admitted to the hospital for the presence of the virus, but we can't because of lack of supplies. This puts staff and other patients at risk. I would have thought that Congress would make the VA a priority for assistance, but apparently not. Also, the distribution of Cepheid test, I hope I pronounced that correctly, test kits from central office to the various VAs had nothing to do with need. Every hospital got the same amount of test kits regardless of caseloads. Are you aware of these problems? These are not unique to my medical center, where everyone is working hard to take care of patients and prevent spread of infection. Yes, doctor, I am very aware of the reporting around all of this. We had Dr. Smith from the San Diego VA as our guest for one of our town halls recently. We had a discussion with Secretary Wilkie as the subcommittee chair of a Veterans Affairs Committee subcommittee. I was on that discussion, and the claim was that there was not a shortage of PPE. We see reporting to the contrary. We've asked and demanded more information. I can tell you it's not for lack of funding. We have sent over $20 billion to VA, most of it to VA healthcare, around 16, 17 billion to VA healthcare. The intent of that money was that VA have everything they need to be able to help our veterans. And not only that, but to hopefully expand beyond that and to help the civilian population. What we were told by Secretary Wilkie and the others on the call was that VA hospital bed capacity of around 14,000 was looking quite manageable. Only around 7,000 beds were filled. They weren't worried about ICUs being overrun or weren't worried about number of ventilators or anything of that sort. They'd already expanded into the mission of helping with some of the state hospitals and state retirement facilities and things of that nature. And they were working in particular to help in certain areas of the country like New Orleans, Louisiana, where a high percentage, I want to say 10% of all veterans impacted by COVID were in, at that time, the New Orleans, Louisiana area. But what I will do is this. I have your information. I'm not going to say what it is for purposes of privacy, but we've got your name, we've got your email address. I'm going to make sure that our office directly connects with you so that we can learn more about what you're dealing with and try to help however we can. And obviously, I'm very sorry that you're dealing with this. Here's a question for Dr. Garfien from Dolores in San Clemente. Dolores asks, since my husband and I are in the 65 plus group, we've been doing our grocery shopping online for the past 2 weeks, as previously suggested. Is it okay now for us to go to the grocery store to do our shopping as long as we wear our masks and keep up with social distancing?
Yeah, that's a question I'm sure a lot of people are wondering. So thank you for asking that, Dolores. The AARP actually just published a nice article on how to stay safe while at the grocery store. If you can look that up online, I think it's a nice one to read. I think this is a personal decision. The fact that you've been able to do your shopping online is fantastic. I know some people have struggled with that. They'll place their order, and then when they get finished and they try to check out, the order will get canceled because the delivery company can't keep up with the business. So I think that there are times when people feel like they do need to go out. So let me just sort of enumerate a few things that you could do to try to minimize your risk if you do decide that you're ready to go back to the store. One suggestion is shop early in the day. Many stores are offering early hours for seniors where it minimizes the risk because they let fewer people in the store, give people a little bit more time to shop, and hopefully minimize the number of people that are shopping in the store that might actually be infected. Plus, the stores oftentimes disinfect in the off hours. They disinfect all day long, but they'll do a more thorough cleaning at the end of the day before the next day. So when you're going in, the store may be a little bit cleaner and less likely to come in contact with the virus. Then when you do go out, wear your cloth mask. But remember that the mask is really designed to prevent the wearer from transmitting the virus to somebody else. They're not really designed to protect you so much from breathing in the virus. I think intuitively there is some protection, but because they're not perfect, the CDC doesn't advise wearing a mask for like a healthcare worker to protect them from becoming exposed to somebody that they know is sick. So just be aware of that. So what that means is wear the mask. It will hopefully provide some protection to you, but also maintain that 6 foot of separation between other people when you're shopping in the store as much as possible. Also, when you get to the store, wipe down the cart handle with a disinfectant wipe. Usually stores will have those available if they're not already doing the wiping down themselves. And then try to only handle the items that you want in the store and avoid touching more items than you need to. So, try to look at the item while it's still on the shelf and then pick it up and put it in your cart when you're ready to take it. Also, when it comes to checking out of the store, there's different options. You can either go to the regular checkout counter, or many stores have the self-serve line. When you go to the self-serve line, you don't have to talk to or come in contact with a checker, but you're also touching a lot more surfaces like the keypads and things, and so there might be some more risk there. Also, the other nice thing about the checkout counters is that many of them have already installed plexiglass shields so that you're actually not making direct contact with the checker. And then remember, the whole time you're out there, don't touch your face. So don't put your hands on your nose, mouth, or eyes, because that's how we get the virus into ourselves. So your hands can get dirty. That's fine. The virus won't go through your hands. Just make sure that you're not touching your face with your dirty hands. So like I just did. It's hard not to. So the other thing that you can do is when you leave the store and you get to your car, have a bottle of disinfectant wipe and clean your hands off before you get inside your car. That way that you're not contaminating your steering wheel and everything else inside of your car. And then when you get home, place your bags on the floor rather than your countertops. Take your items out, put them away. The current recommendation is don't try to use disinfectants on your fruits and vegetables. Cold running water works just fine. It could actually be harmful if you use disinfectants on your food. So we discourage people from doing that. But at any rate, washing your fruits and vegetables is good. You oftentimes can peel them. And if you cook any vegetables, that kills anything anyway. And then when you're finished, wash your hands again. Make sure that you keep your hands clean. And if you can practice that and feel comfortable doing that, that should really decrease your risk considerably.
Outstanding, thank you. And as you said, I'm convinced the more you think about not touching your face, the more you want to touch your face. It's absolutely clear. Tony
Guilty as charged.
It's exactly. Tony in Orange County asks, says first responders are not being tested in many areas, police, fire, ambulance crews, etc. Temperatures are used in lieu of a test. Ambulance crews often go to senior assisted living homes. Some people are asymptomatic. Some do not register a temperature. Well, you're absolutely right, Tony, and I think it's so critically important as the administration now has been required to develop this national testing strategy and to report back to Congress in short order that they have to emphasize testing for our first responders and our frontline medical professionals and those in law enforcement. And I have spoken to our law enforcement community this past week. They're doing an outstanding job on the front lines of this, as are our frontline medical community and others on the front lines who should be tested first. And that's one of the reasons why we need so many more tests. I'd like to see if we're going to expand, and Governor Cuomo was talking about this in New York, but I think we're eventually going to see this in California and elsewhere. If you're on the front lines, you ought to be getting a test. We have to make sure that you're staying safe and that you're not asymptomatically transmitting the virus. Any thoughts on that one, Dr. Garfien?
Yeah, I couldn't agree with you more. We need more leadership in terms of getting the testing out. We need more resources for it. I can talk a little bit more about testing first liners, but I'll save that because I think that's going to come up a little bit later.
Okay. Question for you or from David and Paula in Carlsbad. Please explain the different types of tests available and which type of test will be most useful in returning to normal. Can you also talk about the supply of these tests?
Sure thing. So as I mentioned a few minutes ago, there's the test for the virus itself, and there's the test for the antibodies, and they're used for different purposes. The viral test indicates that a person is actually actively infected. This is really important for patients that are having symptoms in order to help the physician to know whether or not they're dealing with a case of coronavirus versus something else. And that's important because the treatment can be very different, and they want to know what's causing the disease. Also, it's confirming that the person has the virus in their system and is infectious. And so knowing that it's a case of coronavirus infection, contact tracing can be done with that person as a case to find out who they might have exposed and who else needs to be notified that they could have been infected with the virus. Now, the antibody tests are used to pretty much determine who has already been infected with the virus. Some antibodies are produced early on in response to the virus, usually within about the first 3 to 5 days after infection. Could take a little bit longer. but an antibody test might pick up some of those early antibodies. And so it could actually be used to determine that a person with symptoms has coronavirus as opposed to something else. But those antibodies stay even after the person has resolved their infection. So testing positive on an antibody test isn't a conclusive way to say that the person is actually still infected. So we use the test for different purposes, and there's many companies that have produced the test, and I think as the congressman mentioned earlier, there are I think about 80 different companies reported to the FDA that have produced these kinds of tests and are all out there trying to market their tests. Currently, for example, the antibody test, there's not a single one that's been approved by the FDA because these companies haven't had time to do the evaluations to prove that they actually have a high enough sensitivity and specificity to be FDA approved. So the FDA, in response to the epidemic and the demand for tests, has relaxed their rules and now have what's called the emergency use authorization, which allows companies to start marketing their tests even before the evidence has been provided to the FDA to get FDA approval. Those companies should be doing that research at the same time that they're marketing their tests, but so that they can eventually get FDA approval. But that currently there's a lot of tests out there that may not be very reliable. So I think we have to be careful with how much emphasis that we put on the results of these tests by themselves. They need to really be looked at in the context of the patient's clinical presentation and their history and the potential for being exposed. And to my knowledge, there hasn't been any head-to-head studies yet that have compared all these different tests to each other to figure out which one is best. So we don't know what the best test is. You really have to do some digging to find out what evaluations the test companies have done so far to know how the quality of their testing, but that's not widely available. And then, finally, in terms of the supply of these tests, the number of tests is definitely ramping up. I can tell you that UCSD has taken the approach that they've adopted a number of different antibody and viral load or virus tests in order to have, it's sort of like when you invest in the market, you want to diversify rather than putting all your eggs in one basket. The UCSD has done the same thing. And that way, if the number of test kits or reagents goes down from one company, they've got other devices that they can work with. And so they're trying to maximize their ability to do a lot of testing by diversifying. And I think currently at UCSD, they're able to do about 1,000 tests per day. And they're trying to ramp that up to about 1,500. So the supplies are increasing. The tests are going to get better, but we're still working on that.
Well, with Governor Cuomo, that was outstanding. And what Governor Cuomo said the other day was it's a supply chain issue, the international nature of the supply chain with regard to swabs and reagent and other components. That's the gating variable here, and that's where he really needs federal assistance. And that's why, again, we need a national testing strategy. And not to beat a dead horse, but it's very obvious that had we had a national testing strategy from the get-go, we would have been in a lot better position. We know, and in past weeks we've discussed how the CDC had big problems with its COVID-19 test initially in January and February. There was a report recently about potential contamination causing their tests to have false results, and then not having the FDA quickly enough activate commercial and clinical labs to be able to get their tests up and running. And we know, I mean, the data is very stunning, but the United States and South Korea had the first domestic case of COVID-19 on the same day. And today, per capita, I checked this earlier today, doctor, in terms of deaths per million, we have had 33 times more deaths per million people than South Korea. We've had, I want to say, roughly double what they've had in Germany. triple what they've had in Canada. It's just unbelievably sad. And Dr. Fauci and others made clear that had we not had those initial delays, we could have, obviously, we still would have had COVID-19 in the United States, but we have no idea how many lives might have been saved. I bring all that up because it's so critically important that we get this right now, that we're late to the game with the national testing strategy, that the administration take the responsibility, and now Congress has mandated on a bipartisan basis that the administration take the responsibility to get this right, and getting both the standard diagnostic testing scale, the antibody testing scale, and contact tracing scale. We need a plan, and I'm going to fight every single day until I see that plan, and they have to send it to us. Hope I wasn't unclear.
Very much so.
So another one for you from Anne in Vista. Liechtenstein, there you go, Liechtenstein is using bracelets to predict COVID-19, measuring temperature, oxygen levels, etc. Sounds like a Fitbit. Is there any hope for doing something like this in the United States?
Yeah, so, telehealth is a really amazing thing, and it's just taken off incredibly fast right now, especially with everybody going online during the COVID crisis. And so what we refer to these devices as is sensors. They're basically something that is picking up some information from a human being and transmitting it through usually Wi-Fi and maybe through a phone, and then off to a database somewhere where it can be utilized. And I think what this question is referring to, and Anne, if we didn't get the question right, I apologize, but hopefully this information will be useful anyway, is that there are some commercial devices out there, and there's at least one that I found that is useful for, or was designed to measure women's ovulation cycle by measuring things like body temperature, heart rate, skin perfusion, sleep and activity, to sort of monitor the body. Well, similar things can be done for COVID. And last week we talked about the pulse oximeters. This is something that you wear on your fingertip that can measure the amount of oxygen in your blood, and that's what doctors will will use in the doctor's office to get a better idea of oxygenation. And that's the first thing that's what we really worry about with COVID, is that the lungs aren't working effectively, and the amount of oxygen in the blood goes down, and that's a sign of problems, and that's when we need to get people on ventilators. So, and the other thing that we monitor is temperature, to see if somebody has a fever. So if you have a device that's sort of continuously monitoring somebody's their blood oxygen and their temperature, potentially this could have the ability to sort of identify people early who might be infected. And similarly, if you have somebody that is infected and they're at home convalescing, being able to monitor the blood oxygen and temperature could be very helpful for a doctor to know if this patient is okay at home or if they need to be brought to the hospital for additional supportive care. So I think that the companies like this are probably in the process of evaluating the effectiveness of these tools in COVID, and hopefully there'll be some good findings, and these tools will become then more available. But at this point, I wouldn't necessarily recommend that anybody rushes out to buy one, because we don't know exactly how to use them for this purpose yet.
Thank you for that. One more for you from Janet in San Juan Capistrano. She asks, where are the results from recent antibody tests? So few are available. And she also asks, is contact tracing going on now in California?
Yeah, so a few studies have been done using the antibody test in community samples, and what we see is that the prevalence of infection, past infection in the community, is still pretty low. And like I said earlier, the numbers range from about 2 or 3% up to maybe 13%, and again, maybe about 20% in New York City, where the outbreak was the worst. And so there's still a lot that needs to be done in terms of managing the epidemic. Where are the results going? Well, that's a really good question. It depends on who's doing the testing. If they're being done in hospitals, health departments, clinics that are managed and in healthcare systems that are required to report to health departments, those results are going to the health department for monitoring. But if you're going to, some doc in the box, you got a hold of some test kits from China, those test results might not be being reported anywhere. And then in terms of contact tracing, it is starting up in California. Currently in San Diego, there is no direct contact tracing because the county health department doesn't have the resources to do this. And so what they've advised is for patients, they're given information about how to notify all their contacts. And also they're asking the doctors who ordered the test to notify contacts if there's a positive case. Now that's inadequate. And so fortunately, Governor Newsom just announced that he's putting in resources to hire and train 10,000 public health contact tracers for the state. And he's opened up 80 new testing sites around the state. So UC San Francisco has been taking the lead in the Bay Area to develop protocols for doing contact tracing. I know we're working on that here in San Diego, at UCSD and with the county, and with the additional resources from the governor to help to support the contact tracing efforts. I think we're going to really be able to start ramping that up soon because it's going to be essential as we start to open things up again.
Terrific. And I know we'll hear more later this week from Apple and Google and their initiative around contact tracing. And hopefully next week we can talk more about that and understand what we've learned from them. Well, we're just about out of time. And I am so grateful, as always, to you, Dr. Garfien. You have a growing fan club, as you know, and I'm certainly a member of that. But I wanted to turn it over to you for any closing remarks this week.
Well, I have so many different thoughts. I think we've covered a lot. And I think what I'll just sort of end with is to say, we're starting to get to a point here where I think we feel like we can take a breath. We've all worked really hard to practice social distancing. We've taken, we've really suffered through this a lot, but I think we've suffered through it together. And I really respect my community for all the work that we've done to try to slow the spread of coronavirus. Now that we're starting to see that we've got a handle on it, our healthcare system has learned a lot about how to manage patients. So hopefully some of the data will be coming out on the best treatments that are available. The vaccine is still a ways off. We don't expect a vaccine until early to mid 2021. But we're starting to get a handle on this. And so as we start to, open up the valve and go back to life as normal, we need to do it slowly. And we need to do it deliberately, and we're going to do that by continuing to practice social distancing. And so, life will be a little bit different as we start to go back to normal. But then we also have to monitor the things carefully to make sure that if we start to see an increase in cases again, that we look to see what's working and what's not and dial some things back. Hopefully surfing won't be one of those things that gets dialed back. And I think we also have to be really careful right now that we've been cooped up for so long that there's going to be this desire to just sort of get out and take a deep breath and go see all the friends that we haven't seen in a while. And this is really not the time to do it. I think we have to continue to go forward slowly and meticulously and carefully. I think if we all rush to the beach and we have big barbecues and go hang out with our friends, we're going to be in for a load of new cases, and we don't want to see that happen. And then in terms of sort of, are we ever going to get back to those big events where lots of people can get back together, for baseball games and football games and, concerts? I think that's going to be sort of a long way off. So we should just sort of anticipate that and get used to it. But I think if we do things correctly and move slowly and deliberately, we're going to get through this.
Thank you, as always, Doctor. And I'm so grateful for your level-headed clarity of thought and just science first, facts first. It's incredibly refreshing. And I know I speak for so many in our community when we thank you for that weekly dose of reality. What I try to do is I'm developing public policies to be driven by science. And I think it's so critically important right now that we continue to listen to our public health experts, listen to our scientists, none better than we have in our district and our region. Truly, truly grateful. And, as I have said, as we were passing this legislation this week when I was in Washington, we're the United States of America, and we have to stay united as a country. And we have to remember that we've got to help those on the front lines. We have to help one another out, and we have to act with kindness and generosity. And we're a very kind and generous country, and I believe that in the weeks ahead, we're going to offer in the House proposals that speak to that generosity, that focus on those on the front lines, so that don't discriminate on the basis of whether you're a blue state or a red state. As we all know, sometimes politics gets in the way, and it shouldn't in this instance. This is a pandemic and a health crisis and an economic crisis that we all need to deal with together. And I hope that our nation's policymakers are up to the challenge. I want to thank everybody who helped put this together, our wonderful team, Ellen and Adam and Hunter, everybody on the campaign side. Please visit our website where we have a pretty detailed COVID resource page. It's mikelevin.org, and you can go click on the green COVID-19 button. We'll also be posting this town hall and all of the town halls over the last several weeks that we've done with Dr. Garfien. And we're truly, truly grateful whether you post or whether you tune in on Twitter or Facebook or YouTube or whether you're just listening on the phone. We do hope that you'll visit with us again next Saturday afternoon for what I hope is another informative town hall. Thank you. Stay safe, stay healthy. Thank you for everything that you do for our community, and we'll see you again next week. Take care.